Signs and symptoms of type 2 diabetes. During the early stages of the disease, type 2 diabetes often doesn't present any symptoms at all, according to previous research. Still, you should be aware of the symptoms and early warning signs, such as the following: frequent urination and extreme thirst, sudden or unexpected weight loss, increased hunger, blurry vision, dark, velvety patches of skin called acanthosis nigricans, fatigue, wounds that won't heal. If you have one or more risk factors for type 2 diabetes and notice any of these signs, it's a good idea to call your doctor, as you may have type 2 diabetes. Causes and risk factors of type 2 diabetes. At the root of type 2 diabetes is insulin resistance. And before you receive a type 2 diabetes diagnosis, you may be diagnosed with prediabetes. Insulin resistance. Type 2 diabetes is marked by high blood sugar that your body can't bring down on its own. High blood sugar is called hyperglycemia. Hypoglycemia is low blood sugar. Insulin resistance, the agency points out, doesn't develop immediately, and often, people with the condition don't show symptoms, which may make getting a diagnosis tougher. Prediabetes. Insulin resistance sends your pancreas into overdrive. And while it may be able to keep up with the body's increased demand for insulin for a while, there is a limit to insulin production capacity. And eventually your blood sugars will elevate, leading to prediabetes, the precursor of type 2 diabetes, or type 2 diabetes itself. Type 2 diabetes risk factors. Here are some of the factors that may affect your risk of type 2 diabetes. Obesity. Being obese or overweight puts you at significant risk of type 2 diabetes. Body mass index (BMI) is a way of measuring whether you are obese or overweight. Poor eating habits. Too much of the wrong kinds of foods can increase your risk of type 2 diabetes. Studies have shown that eating a diet that's high in calorie-dense processed foods and beverages, and low in whole, nutrient-rich foods, can significantly increase your risk of type 2 diabetes. Foods and drinks to limit include white bread, chips, cookies, cake, soda, and fruit juice. Foods and drinks to prioritize include fruits, veggies, whole grains, water, and tea. Too much TV time. Watching too much TV and sitting too much in general may increase your risk of obesity, type 2 diabetes, and other ailments. Not enough exercise. Just as body fat interacts with insulin and other hormones to affect diabetes development, so does muscle. Sleep habits. Sleep disturbances can affect the body's balance of insulin and blood sugar by increasing the demand on the pancreas. Insulin resistance and obesity are common denominators of these health conditions. Being over age 45, the older you get, the more likely you are to develop type 2 diabetes. But in recent years, an increasing number of children and teens have been diagnosed with prediabetes and type 2 diabetes.